Well, howdy YouTube family, it is Bolt CRNA coming to you with another week's topic. So what we're going to talk about this week is what was my specific path from getting from nursing school all the way to starting CRNA school. Everyone kind of gets there a little bit differently, and I understand that you can gain wisdom from hearing other people's stories and their pitfalls, shortcuts that they took, things they would have done differently, things they would have, done better in a certain way. So I'm going to try and help you out with a little bit of my backstory, and hopefully that will save you some heartache. Step number one for if you want to become a CRNA is you have to be an RN first. My first step was becoming an RN. I did my prerequisites at a community college, did 2.5 years or so at the community college getting things underway, making good grades, keeping a 4.0 science GPA, and then applied to a local BSN nursing program. Now, a lot of you may say, hey, I wanted to do the ADN path, or there's other paths you can do an associate's degree in nursing or bachelor's of science in nursing program. I chose a bachelor's of science in nursing because the local programs near us, the ADN programs, did not focus much on specialty rotations. They didn't focus almost any at all on ICU or critical care concepts. They were known for putting people out who would do med-surg nursing, and their general, response to wanting to be ICU or pediatrics or OB or specialties was, that's for after you've done a few years of med-surg. We're here to train you to be med-surg frontline nurses, and then over time you can work your way to those positions. I didn't want to do that. I wanted to go to CRNA school. The BSN program in the area was known for having specific specialty rotations. They a lot of times turned out students who went straight into the specialty areas of nursing, and that's what I wanted with ICU. Actually, at this point in my time, I didn't know for sure what I was going to do. I knew I was going to go to grad school, but I didn't know whether it was going to be CRNA or something else. In fact, I didn't actually know what a CRNA was. I knew about nurse practitioners, but I didn't know about CRNA. So I actually had it in the back of my mind. I wanted to do ICU because I could learn a lot there, and I felt like it would challenge me a lot. I also considered maybe ER, and then I was going to apply to medical school. So I was actually doing a lot of my prerequisite work and additional extracurricular stuff to get myself ready for the MCAT and get myself ready for medical school. Luckily for me, second semester of nursing school, I did a rotation in surgery, and I met a CRNA there. And actually in that room, I was paying attention to the surgeon, not because I really wanted to be a surgeon, but because I was interested in what he was doing. But the surgeon was looking at me, and he was talking about what my plan was ultimately and long-term goals, and just making chit chat. And I mentioned to him that I was interested in maybe medical school and continuing on with my education. And he looked over at the CRNA and said, that is who you want to be. If you're in nursing school now, you would be smartest to go this path here. He's the smartest guy in this room. He has, a great work-life balance. He makes amazing income and gets to do a job that, is really interesting for most people. I was really piqued by that because I thought, my God, I usually don't have physicians recommend other areas to go into. Usually they're like, yeah, follow me along. You want to do this. This is the best thing you can be. But to have someone say, oh, this other job is maybe better, I thought, let me look into this. And I had never really considered anesthesia up until that point, but by going behind the curtain with the CRNA, and of course the CRNA took me under their wing and was like, let me show you a little bit of what I'm doing. I got to follow them to do another case where they did an interscalene nerve block, which completely freaked me out. I thought it was like magic to look at someone sticking a needle into someone's neck, and they used a nerve stimulator because back then in 2010 they weren't using as much ultrasound. And I thought it was insane to look at someone like targeting nerve endings here and having the arms twitch and the body move and then injecting medicine around it, and the whole patient's arm went numb. And I just thought this was the coolest thing ever. Procedures, you get to do like difficult IVs, and you get to, induce anesthesia and do airways and keep people safe throughout the whole procedure. And then you get to wake them up, and then like magic, the patient's like, oh, it's over. I can't believe the surgery's over. I was so scared before. And now the entire procedure's finished and I'm waking up and I feel good. To me, that was amazing. And something just really struck home to me. Like, this is what you want to be. This is what you want to do. I continue to, of course, investigate. You don't just completely make a decision off of one day's experience, but continue to investigate, searched online, did some more shadowing experiences and things like that. And from those experiences, realized this is for sure for me. This is exactly what I want. Also, they had just transitioned to a doctorate program at that time period. They were transitioning all their programs from master's to doctorate. And I always knew from a young child, like sixth grade, I knew I wanted a doctorate in anything that I did. Whatever I was going to put my mind to, I wanted to know the most about it. I wanted a terminal degree in that field, whether it was archaeology or whatever it was going to be. It was going to be a terminal degree because I was going to learn everything that I needed to know about that specialty. Because I don't know, I guess I've always been fairly ambitious. So they were transitioning to doctoral degrees, and I said, this is it. This is my cue. I began focusing in nursing school on getting really good at critical care stuff and pharmacology because I knew ICU was what I needed to go straight into, and I needed that experience to become a CRNA. I also focused in on making networking connections with the nurse manager in the local ICU. I actually worked part-time at a local hospital that had a cardiac and a medical and surgical ICU. I worked in the occupational health department, so completely different from the ICU. It was an outpatient clinic where we did drug testing and breath alcohol testing and strength testing for new hire physicals and things like that. A TB skin test for all the employees of the hospital. I helped with all of those things. But my manager knew the manager of the ICU. So I let my manager know, hey, when I graduate as an RN, there's no positions for you in occupational health as an RN. So I was like, when I finish, I'm going to have to move departments. Could you put in a good word for me? She did. And then when fifth semester came around and it was time for me to go to the ICU where I was going to precept, I made sure to make a really great impression. I brought donuts to the nurses there. I would jump in and help turn and rotate patients whenever I was not busy with my current patient or my preceptor was teaching me something. I actually was training in the cardiac ICU as my preceptorship was cardiac. So I helped everyone as much as I could. I really tried to study on my free time to be as intelligent and inquisitive as I could, but also not arrogant. You know, there's a very thin line. You don't want to ever come off like a know-it-all or arrogant. You want to be teachable, learnable, but also don't come off like you don't know anything. It's a delicate balance, and you're not going to get it perfect, but really strive to kind of hit that level. And that's going to be true for anyone in any of these medical training specialties. There's a very specific line between being foolish and not knowing anything and then becoming arrogant and egotistical and feeling like you know it all. So definitely aim for that middle ground. Lucky for me, I got a job offer at the end of that preceptorship when it was time to graduate. They said, we want to take you on. You're going to have to work night shift. All the new grads have to work night shift here. I started completely overwhelmed. I want that to be very clear. I did not start in the ICU being like, oh, this is so easy. I'm just going to pump out this year or two and then I'm going to go to the CRNA school. I started being fully aware that this was a huge, overwhelming task, that I was responsible for people's lives. I was responsible for a lot of pharmacology, physiology, just workflow and time management, things that a 23-year-old, 24-year-old, they're not going to be very good at baseline, but especially not in a high stress, high acuity area where patients could live or die and will live and die based off of things you are doing and other people around you are doing, and you are seeing death every day. Well, maybe not every day, but many days you will see death directly. And that is a lot for a young person to kind of take on. So don't think that when you get into the ICU that, oh, this is just another like checkbox you're going to click and then you've done it and now it's time to go to CRNA school, easy peasy. No, it's going to be overwhelming. It's going to be very stressful. And if you do nothing else with your career in life but become a successful ICU nurse, that's an amazing task. And that is a huge undertaking and you're doing great. So take a minute. Stop planning for the future and you're planning for the future at this moment watching this video. But I'm telling you, when you get to this phase and you become an ICU nurse, especially as a new graduate, get out of your head of like your task lists of getting ready for CRNA school and just put everything you've got into being the most amazing ICU nurse that you can be, because your patients deserve that, because you deserve that, your coworkers deserve that, and it will take all you've got just to be safe and competent and capable for that probably entire first year. Maybe after a year and a half or so, you're going to have enough of a hang and a grasp of it that you're doing a good job without constantly just studying and keeping up with all the, tasks, and also studying pharmacology and just trying to learn your nursing intuition and things like that. Once you get better at those things, then you can kind of pivot your mind and be like, okay, so I'm doing this. I'm doing it pretty okay at this point. It will take you at least a year to even be okay at being an ICU nurse. Side note, that's why most programs want you to have more than a year of experience, and why you probably need more than a year, because you're just really basic competency after a year of ICU nursing. After that time, then I recommend create those lists out. Start looking at, like, all right, what am I lacking? What do I need to be working on? What do I need? I need my CCRN certification. Okay, so I need to set aside time to be studying for that. I need my GRE. I need to set aside time for studying that. These are both going to require books or material you're going to have to buy to prepare and go home after work and study in your free time. That sucks, I'm going to tell you, because you've just been enough away from school to start enjoying being off on your free time and not have to go home and like study or do work. But now you're going to go do work when you get home. And you probably spent your whole first year of ICU nursing at home studying ICU concepts and pharmacology and physiology and other things like that keep you competent when you're at work. So yeah, there's not really a great time for you to be fully nothing to do. There's like a task list for the many years of your probably 10 or 11 years of time period to become a CRNA. You're studying for your CCRN, you're studying for your GRE, you need to be looking at what extracurricular things am I doing or can I do? And that's what I did. I said, what can I do that makes me obvious as someone who's willing to give back to my community, who's willing to do things for other people, who is interested in helping people and healing people, and not just becoming a CRNA for money and ego and power and all these negative things. And there's a lot of people who are kind of looking for those things. So the panels are often looking for people with a moral compass and ethics, and they can't just take your word for it that's who you are. So you kind of need to be able to show there's some interesting elements of you, that you're a decent person, that you do the right thing when no one else is watching. And so the best way I could think to do that, and one way that I kind of wanted to do that, was there was a local free clinic nearby that was helping run, she was another nurse actually, she was helping run a free clinic, and she needed help triaging patients who had no homes, people who had no health insurance, people who just need like an inhaler and had asthma, but they're living on the streets. They had a nurse practitioner, but they needed an RN who could do triage and kind of be there to help out in the clinic. So I started doing that for just 6 or 8 months before I went travel nursing and was gone. But I would go, once or twice every couple weeks or something to help out. So I don't want you to look at the extracurricular stuff as like a punishment or like just an extra task you have to do. Look at it like, how can I do something I actually like and enjoy and do well? And how can I do that to kind of help boost my application in a positive way? Beyond doing that and getting my GRE and the CCRN, which wasn't easy either. Both of those exams took money and time, and I had to take the CCRN twice, and I had to pay for it twice. It was $300, I think, both times. So I did that. You need to get 3 letters of recommendation. That was something else that I had to get done. I had to pick a nursing school professor, a ICU doctor, or a CRNA that I shadowed. I picked an ICU doctor that worked with me a lot, who really knew my clinical abilities, and also said to me one time, you would be foolish staying here in the ICU. You need to go on. You need to go do more stuff so you have more scope of practice and can use more of your skills and knowledge. He wanted me to be a pulmonary critical care NP and work with him directly. And that was his preference, but I told him, I really want to be a CRNA, and he said, fine, I'll write you a letter for CRNA school. And then the nurse manager, that was a requirement, so I was able to get a letter from a nurse manager for me. I knew I needed money. I needed some more money for CRNA school, but I also wanted to travel some. I didn't want to do all of my time in this small town of Alabama, never go travel or see the world, because I knew that once I started 3 years of CRNA school, it was nonstop. There's no real breaks. There's no time to like go travel or have fun. And I knew it was going to be 60, 70 hours a week of my time. It was going to be brutal. So I thought, I don't want to be 30 something when I graduate and have never gone out and just like had fun and experienced the world and just like grinded for this whole time nonstop. So I thought, what's one way that I can travel a little and also earn money at the same time while also preparing my application for CRNA school? So travel nursing, obviously. And I went to places like Connecticut. And the thing that I wanted to do is every 3-month contract I took, I wanted to try something new. I wanted a new adventure. I wanted to do something that challenged me, that just gave me a little excitement and thrill. I did Shaolin Kung Fu for 3 months in Connecticut. I did hang gliding in San Francisco, skydiving in Atlanta, mountain hiking in Tennessee, windsurfing and riding horses on the beach in Texas, in LA, just like regular surfing on the beach, not windsurfing. So that was kind of my little agreement, was everywhere I'm going to go is going to be fun and I'm going to enjoy it, and also I'm going to work a little overtime and I'm going to save up money. That was like probably a year or so of time as a travel nurse, a year and a half approximately. And at that point, I had done everything I needed to do. I had compiled a list of all the programs that kind of fit what I thought would be the top programs for me. They also were the programs that I met the requirements for. So keep in mind, certain programs will require like a specific physics course, or certain programs will say we want organic chemistry 1 and 2. I didn't have both of those chemistries, so I couldn't apply to those types of programs. Other programs might be exorbitantly expensive, so I was not going to pay more than $100,000 for just tuition alone for the 3-year program. So anywhere that was more expensive than that, I just wasn't going to apply to. I had kind of a certain criteria of things, and I had done, nowadays you can find much better sources that are able to give you tons of information. A lot of people compile this information for you and sell it on a course or something. But back then you just had to figure it out on your own. I had created an Excel spreadsheet and I had my top 3 programs at that point, and I had been travel nursing for about a year and 2 or 3 months. So this is essentially a little over 3 years of ICU experience I've got at this point. I have been saving up money. I've got, $50,000 at this point put away in a savings account, and it's time for me to apply. So one of the programs never responded to me. They didn't even send me a rejection letter. They didn't say anything. And I actually called into their department and no one ever answered the phone. There was no voicemail to leave. I honestly thought that program got shut down and just didn't, the website wasn't updated or something. And I thought, okay, well, this program shut down. Little did I know, that program didn't shut down. It was just poorly ran so badly that you would have thought it was shut down from the outside. So dodged a bullet that one. The second program that I applied to actually wanted to talk to me. They wanted to invite me for an interview. It was going to be like a 3-day weekend. I was going to have to take off work. It ended up costing me $1,000. So there's a little side note for you guys who's applying to other places across the country and stuff. It's going to cost you money. Not only is the actual application cost you money, but the time off work, the hotel, the rental car, the flight, whatever else you're spending on food there, that all comes out of pocket for you. It ended up costing me like $1,000 to interview there. I was excited. I thought it's an investment. I'm going to make it work. Everything was clicking well. I thought this was going to be it because it was a big name program. Institution is a name that is known throughout the world. They do a lot of really good research, a lot of innovative stuff. But something that I did not understand then, that I understand now, is that a lot of times these types of facilities, big academic type hospitals, they're going to have many types of trainees, primarily physician trainees. And their physician trainees will be their main focus. All the other people they're training is going to be secondary to them. And so the learning experience for CRNA students specifically there is going to be where your cases and your skills and all the things that you're trying to get done is always going to play second fiddle to the physician trainees. And the program directors and stuff, of course, are going to tell you, that's not true, that's not true. It's true, unfortunately. And your training is going to be primarily done in medical direction model. And the medical direction model is not the model that I ever choose to work in or ever wanted to train in. Even back then, I understood medical direction was very restrictive. It was the least amount of autonomy. I never wanted to train in that environment. I didn't want to learn as a student how to operate mostly in that type of setting where I'm not allowed to practice autonomously. I'm not allowed to really use my skills and brain on my own, or I'm repeatedly seeing the CRNA I'm training under being like disregarded or undermined by a physician anesthesiologist who is actually the one in charge of the case and in determining like the way that the case goes. And there's a whole bunch, there's 7 TEFRA laws that you have to obey to bill without it being fraudulent in medical direction. And if you look at those 7 TEFRA laws and you understand what all of these mean, there's just no way as a CRNA that you're going to be able to practice autonomously or even nearly your full scope if those 7 TEFRA laws are being maintained, which they are supposed to be if you're billing for it. I never wanted to practice in that manner, and that is primarily the way that they practiced in this facility. It ended up being for the best that I didn't get in here because it just wasn't right for me. Is it saying it's a terrible program? No. I have worked with other people who have graduated from this program. They're smart, intelligent people, and they're good CRNAs. But it's a certain type of person and type of practice that you probably want to be working within if you go to these types of programs. So you should know that about yourself. For me, I always wanted to do independent practice. I always wanted to do CRNA only groups. I always wanted to do nerve blocks and all of my skills independently. I wanted to manage my patient in the pre-op setting, the post-op setting. I wanted to write the PACU orders. I wanted to make choices independently and understand that I had full faith and knowledge of my skills and ability, and there was no one doubting that or challenging that or making me feel like I was lesser than because I didn't go a different training route. And unfortunately, that's just something I've observed a lot from people who train in certain settings and work in certain settings. And so that wasn't what I wanted for me personally. It was okay. At the time, I was devastated. When I got my waitlist letter that I was on the wait list there, I was devastated, and I asked them, hey, what did I do wrong? And I recommend you guys do the same thing. Anytime you get waitlisted or rejected from a program, ask them, say, hey, did I do something wrong? Or is there something I need to be working on to be better? And if they give you real constructive feedback, like, yes, you've made a D in this class, or you did something, you don't have your CCRN and we really expect people to have that, or you don't work in a high enough acuity ICU, we really want to see a few years of additional experience. If they give you that kind of feedback, that's amazing. So that means you really probably should be working on those things. If they give you feedback like, it just was a competitive year, or maybe this isn't a right fit, abstract concepts, maybe this isn't the right program for you. Like they weren't feeling you, and maybe you shouldn't be feeling them. And that was the feedback that I got. In fact, one of the main things I remember them telling me is I didn't keep my suit jacket on through the whole interview because I was hot and nervous. And I thought, oh, that's bad. Like if that's your main feedback to me that I need to be working on, maybe this isn't right for me. Third program, I am pretty crestfallen at this point. In fact, I'm starting to wonder, is this even the right career for me? The first 2 programs that I applied to or interviewed at, I got rejected from, and I was told, we don't want you. And you start wondering, and many of you will probably experience this, where you start wondering, is this even right for me? Can I be a CRNA? Am I supposed to be a CRNA? Is this the universe telling me, like, this is just not for you? Like, you should not do this path because you're not capable, or maybe this isn't a good fit for you. So I really started to wonder about this. So after I got the invite to interview at the 3rd program, I was even debating for a minute, do I even want to go? Like, because it was going to be another $1,000. It was going to be another flight cross country. I was living in San Francisco at the time, and I was going to have to take time off work and fly all the way to Tennessee where this program was at. And I was just thinking, maybe this is just not for me. Is there something else? Maybe I should work in the corporate field. I was starting to look at different types of jobs and even different like masters in business and other things like that I might pivot into. Something deep inside was like, no, you need to give it at least this one more shot. You need to go interview. You need to give this a full effort. And if you keep getting the door shut by you, then maybe consider something else, but you really need to keep trying at least one more time. I flew to Tennessee. I interviewed at the program. I got a much better feeling this time. It was much more, friendly. Of course, the professors are all very professional, and it's still kind of a stressful situation, but I just felt like things clicked. And a lot of people may tell you that about the program that they finally pick or that they get, selected for, is that it just fits and they just feel at comfort and at home there. And I felt that way. And when the interview was over and I left, I just kind of felt at peace, and I was like, I think this is right, but if it's not, I'm okay with that. 2 days later, I got the call and they said, hey, we want you in our program, and the rest is history. I started that program 6 months later, when it was matriculation time, I continued working in ICU. I continued celebrating. A lot of people ask me, what should I do once I get my acceptance letter? Like, how many books should I be reading? How can I prepare? What can I do? Honestly, I don't recommend you doing a lot of stuff unless you know you're very weak in certain subjects or you really struggle to get by in anatomy and physiology or something like that, and you're worried you may immediately fail when you start CRNA school. I would say enjoy yourself. Work, make money, put money aside. This is a good time because you're not going to be able to work for about 3 years when you start school, and everything's going to cost a lot of money. So the more you can put aside, the better. And the more memories you can make, the more fun you can have, the more freedom that you can experience. Treasure it, take pictures of it, put it up on your wall in your office for the 3 years of CRNA school. So when you're studying at that desk all the time for years and you're just feeling like you're in prison, you can look up at that thing and say, at one point, not that long ago, I enjoyed myself. I had freedom. I could go places. I could go on a vacation. I could go to Hawaii. I had friends that I could hang out with. Like, there was times where I could do those things, because you're not going to be able to do those things most of the time for about 3 years. So I recommend people, before starting CRNA school, really invest in that side of things. If you are truly weak in certain areas and you know that about yourself and you barely pass certain topics or something, there are programs and stuff. Confident Care Academy is one of them that I like a lot. They do really good work at preparing people for not only being a good ICU nurse, but also for CRNA schools. There are probably other places and options too. Those are just the ones that I know of personally that I would recommend. But yeah, I mean, you can study up a little bit, but just don't overdo it, guys. Like, chill out, enjoy yourself. You will really regret not doing that if you grind to the bone until the day CRNA school starts, and then you realize, oh, now it's going to be a lot more work for the next 3 years and it's not going to stop. All right, guys, so that was my entire story from nursing school to CRNA school, my path, how I got there, kind of my stats. My science GPA was a 4.0. My cumulative overall GPA with all of my credits for my entire bachelor's degree was a 3.4, I believe. And yeah, I had no F's or anything like that. I had 1 or 2 C's. I had a C in statistics, which I didn't retake. They didn't mind my C in statistics. Community health in nursing is what I made a C in nursing school. But outside of that, I had all A's and B's. All of my sciences were A's. And I had a pretty good GRE score. I think it was a 305 combined score with a 4.0 writing. And then, yeah, I had my CCRN. So those were my basic stats on paper, and I had 4 years of ICU experience, including cardiac, neuro, medical, surgical. And I did a little bit of charge nursing, but not that much, and I really didn't have many other leadership opportunities for me. I recommend you guys focus more in on that, though, because I was kind of lacking. But I want to hear from you guys below what your experience was like getting into CRNA school, what stats you had. Maybe you can share some of those details so other people who are watching this video can see and say, okay, I see those stats and I stack up here, and kind of just be a place to converse, because we're all here to help each other, and I'm always happy to share whatever pitfalls I had or even shortcuts I took that might be helpful for you guys. And you can follow me on Instagram or Snapchat. It's Bolt CRNA on both of those forms in case you want to see me more frequently or on a daily. And until next time, that's Bolt out.